It's reverberating in the medical world, certainly among patients. There are millions of older people out there, 70 years and older, who are healthy, older healthy people who take an aspirin a day with the hopes that it will prevent their risk of having a heart attack or stroke and prolong good health. That's what they hope. That's what they've been told. As you say, that's been the wisdom. This study, a good study, nearly 20,000 people, says that is not the case. That is not the case. And again, this is a surprise, I think, for a lot of people. But I think no one is questioning the veracity of the study. I think it's going to change how doctors recommend things to their patients. And as the author said, I think in a telephone interview to somebody, he said, sometimes the ugly facts slay a good theory. And that's the case here. It's been a theory for a long time, but the facts now really do make a difference here in terms of how medicine's going to go forward.
So who should be taking an aspirin a day?
So think of it like this. People who have had a heart attack or stroke in the past, they're the ones that are probably going to have the most benefit. The issue is that blood clots could actually cause a second heart attack or stroke. A low-dose aspirin could prevent that from happening. Also, they also say adults 50 to 59 who have a 10% or greater 10-year risk of having heart disease, cardiovascular disease, they also should take an aspirin. Even if they haven't had a heart attack or stroke yet, people who are 50 to 59 should. You may say, well, why 50 to 59 but not people older than 70? As you get older, your blood vessels become more fragile. You think it's just a low-dose aspirin. You got to get the mentality that a low-dose aspirin in an older person could pose some real risk. That's the thing. And the risks don't outpace the rewards here.
Okay, so what about people who were not in that list that you just outlined? What should they do if they've been taking aspirin? Stop right now?
Well, I think that, the issue is that if your doctor recommended that you start taking aspirin, I think you got to talk to your doctor first. Make sure that there's not some other reason that they're recommending this. I mean, obviously, I think a lot of people are going to end up stopping their aspirin here, but I think you should do that with, in consultation with your doctor. The big advice, don't start taking an aspirin just to prevent heart disease or stroke, especially if you're 70 years or older and you're healthy. The risks, again, just are greater than the rewards here. People actually had significant bleeding as a result of this, so I think that's why the authors were so concerned.